Welcome back to the Takis McGinnis Elder Care Law Hour. I'm Joshua Hunter, a public benefits specialist at Takis McGinnis Elder Care Law. I help people understand their Medicare and veterans benefits. Joining me for today's session is Dr. Nicole Salloum, Associate Chief of Staff for Primary Care, to demonstrate how the VA is using telehealth to treat veterans. Welcome.
Thank you so much for having us.
Thank you for being here. What some of our viewers may not know is that the VA has the largest telehealth program in the country. Can you show us some of the ways that the VA is making it easier for veterans, even in rural areas, to access doctors and specialists?
Sure. So we have a couple of different options. The first is what's called home telehealth. So that is where any member of your care team, from the clinician to a pharmacist you may be working with to an RN care manager, can set you up for monitoring of your medical conditions in the home.
Right.
So if you're someone who has diabetes, high blood pressure, heart failure, some mental health conditions we can monitor, such as chronic depression, PTSD, we can enroll you and send the equipment to your house and monitor you at home. And the goal of that is to prevent hospitalizations and complications.
Right, help them stay at home. So how do you qualify?
So anybody who is enrolled in the VA with a chronic medical condition qualifies, which is great. The way you would get referred to the program would be to talk to one of the team members we discussed, so either your physician, nurse practitioner, or physician assistant. You could talk to your pharmacist, or you could talk to the nurse care manager on your team, and they would place a consult through our electronic medical record to what's called home telehealth. And there is a nurse that helps coordinate that program, and she will call the veteran and just make sure that they're interested and they agree to it. And if they do, then we actually send them the equipment from the VA. There's no cost to the veteran. We mail the equipment out of Denver, and it's mailed to the patient's home. There's step-by-step instructions on how to set it up. They do not have to have a landline. There's a 4 gigabyte modem that comes with it that can attach to any cell tower in the area. So it's suggested when the patients are setting it up that they put it near a window, but it does not link to their personal, Wi-Fi or cell phone plan.
Okay, so it's kept separate.
It's kept separate,
Okay,
yeah.
great.
So it used to be previously you had to have a landline. If you have a landline, there is some other equipment we can use, but you don't have to have one to be enrolled, which is great.
Yeah, is the setup complicated?
It's there are special instructions, but again, there's a whole team. There's a 1-800 number to work you through it. The boxes are all labeled. Open this box first, plug this in second, but there's always a telephone line available to help talk you through it.
Great, that sounds easy and usable. Yeah. So who would be a good candidate for this?
So good candidates would be people with chronic medical conditions that their teams are wanting to do some extra in-home monitoring. So for my example, in my clinic, I use it with my patients with heart failure. They weigh themselves daily, and that data gets transmitted directly to our home telehealth nurses who are monitoring that.
Wow.
So if everything is stable and their weights are doing fine, I might get an update every week or two by an email alert in the electronic medical record saying, here's your routine update on Mr. So-and-so, everything's fine. We'll keep monitoring. They always send us an update right before a visit, which is nice. So, here's everything that's been going on in the last couple of months, and so we can review it before we see that patient. And they can also pick up on things that are out of the normal range, which is where the program is really helpful. So for example, if you have a heart failure patient and we notice that 3 days in a row they've had a slight weight gain, that home telehealth nurse will actually reach out to the patient by telephone to assess, hey, what's going on? Are these weights real? Have you taken your medication? And then the really nice thing is they can take that information and contact me and the nurse on my team directly. So we can together create a care plan and say, maybe we need to have you take an extra dose of a water pill, or maybe adjust your medications, with the goal of trying to prevent that weight gain from getting worse.
Yeah, so a great preventative service on the front end.
Right.
Awesome.
And same for blood sugars, so we can monitor blood sugars, and those will go to either the clinician, or if we have a pharmacist that works with us, they can call the patient and intervene and adjust their insulin or adjust their medications based off of changes we find. Hypertension, we can keep a close eye on your blood pressure, and we can say, hey, things are going great, continue your current medications, or, oh, I noticed you've been out of range for a while, what's going on? Maybe we need to make some changes.
Okay. I'd also heard a little bit about VA's ability to do Video Connect. Can you tell us some about that?
That is very exciting. VA Video Connect is essentially a FaceTime visit that we can do with our patients, and what's really exciting about that is we are taking the visit to the veteran. So this is really great for people who have difficulty coming to appointments, maybe in the more rural areas, female veterans, you know, who have child care problems or more problems with getting to appointments, or just somebody who says, hey, you know, I'd really rather the option of having the visit in my home than having to come in.
Something quick and convenient.
Something quick and convenient. So there's 2 ways the VA is doing Video Connect. We can do them by scheduled visits. So if you called in and said, hey, I'm having something go on, but I'm not available till Thursday, we could schedule that visit for you. But if you said, no, I really want to see Dr. Salloum today, I can create an on-demand visit, or any of my team members can, and an email link would get sent to the patient and the clinician, and anytime within 12 hours, we could have that visit, which is really great.
Wow, that's awesome. Yeah. Well, great. So how does somebody get involved with that? And
so they would talk, there's no cost to the veteran. If you have an Android device, you don't need the VA Video Connect app. Okay. If you have an iPhone or an Apple device, you need to download the VA Video Connect app, and that's free. Your healthcare team can help you with it. We help our patients download that app in the clinic while we have them there and show them how to use it. We can actually do a test visit with you before you leave to check your connection and make sure that everything's working. But there is no cost to the patient.
Great, that sounds pretty easy to get involved with.
It is. It's really exciting.
Awesome, awesome. Okay, so were you wanting to show us anything with that today?
Sure. So we have a volunteer veteran that was willing to join me for a Video Connect visit this morning. So I'm going to turn the screen around so you could see what the clinician would be seeing during a visit. So this is our, we need to turn our volume back up, I think.
Do we?
Can you hear us, volunteer patient? I think he can. Okay.
Did we get a wave?
We got a wave. So this would be what I would see as the clinician on the side of the screen. You can see that I can see the patient there very clearly in the window. There's also a chat box. I don't know if my arm just moved that we can free text and chat in. And if I put the camera up, you can see that. Wave, Jeffrey. There's a clear picture between the person on the clinician end and the patient side. There's also a button here where we can share our screen. So if I wanted to review with the patient their lab results or their imaging results, I could pull up their medical record and share my screen with them. And they could see exactly what I was talking about.
That seems really useful, and it looks clear.
It is very clear. I've used it in a couple of patients to monitor their blood pressure. If they have a home blood pressure cuff, we can have them put their cuff on their arm and watch them check it. And then we can actually record that in their medical record. I've checked skin lesions this way. I've called to check on patients who have, you know, urinary, I'm sorry, not urinary symptoms, respiratory symptoms. Sorry.
Well, no, that's okay. That might be something you don't want to check on with the video, right?
Right.
Well, good. That sounds really useful.
Yeah, it is.
And I know you said you had something else on your computer you wanted to talk about too?
We do. We have My Healthy Vet, which is a way patients can email us directly. Let me see if I can get this full screen to go away. There we go.
Get to see the real life tech side of things.
The real life tech side, and it looks like the window has actually closed, so sometimes it closes us out. But we have an online system called My Healthy Vet, where veterans can log in, they can see their medications, they can see their lab results, they can refill their medications, and they can electronically communicate with any member of their healthcare team. So they can email us any day or time of night, and we can respond. Somebody on the care team can respond to them.
Yeah, so that's a good way so they don't have to remember all of those things. They can go find it.
They can go find it, exactly, and then send you a message saying, hey, I forgot to ask you this, or I noticed something, you know, on my lab result. Is that something I need to be worried about? And you can either choose to call them back, or you can communicate through the email.
So you can walk them through the whole process without them having to come all the way in.
Correct.
Okay, well, how does somebody jump into that?
So you can enroll in My Healthy Vet. Again, you can call the 1-800 number we'll show at the end, or you can talk to your team while you're at your visit.
Great.
And we actually have people that are in the clinic areas that can help you enroll. Our patient libraries are another good place where you can enroll, and they can help show you, send a test visit to your team to make sure that you know how to do it.
So help you get signed up and run the demo.
Correct. Yeah, running the demo is key. It's really helpful to be able to walk somebody through it, and then they know how to use it.
Right. I know I like that hands-on experience when I'm learning something new.
Yes.
Okay.
Our veterans do as well.
I know I'd also heard about Anywhere to Anywhere Together. I was really excited about this part.
It is very exciting. The VA passed legislation in May of 2018 that lets us treat any veteran anywhere, taking the visit to them. So that's important for us at Tennessee Valley. We have patients that live across state lines in Kentucky, in Tennessee, Georgia.
Here, let me get this out of our way real
close
quick.
that.
There you go.
So, you know, if I wanted to do a video connect visit like this with my patient who lives in Kentucky, there might have been a state law that prohibited me as a physician with a Tennessee state license performing that visit. But that new piece of legislation says I can talk to my patient wherever they are. So if they're in Florida on vacation and they said, hey, Dr. Salloum, I need something, I want you to look at it, we could do a video connect visit. And I don't have to worry about, you know, the law requirements of it.
It's making things far more accessible, right?
Far more accessible. It helps with resource sharing. So if there's a VA that has some resources they could share, some staff that are underutilized, they can help other facilities out. And the VA is working nationally. You know, if we have facilities in Mountain Home, if they have a clinician who could help provide services to our patients here in Tennessee Valley, we could share those and also do it across state lines.
Yeah, that sounds like a really good move in the right direction, for sure.
It's very exciting.
Okay, great.
Yeah.
So I know we have your contact info and everything.
Yes.
Can we show that on the screen? Great. And this is how you can get a hold of the Tennessee Valley Healthcare System. This is, you know, Dr. Salloum. She was here to help us today. Thank you again for being here.
Thank you so much for having us. And yeah, feel free to call the 1-800 number or talk to your teams. If you're an enrolled veteran, we'd be happy to help you with any of these services.
And you're still seeing patients and everything,
I
right?
do still see patients, yeah. So I use this technology, and I think it's a game changer in being able to have our patients access us in ways that don't require them coming in.
That's great. Well, I know it's about time for another break, and we have up next our Elder Care Coordinator, Deborah King, to talk about a tool to help those who are dealing with hearing impairments. So stay with us.